Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health. Before I give my COVID-19 update, I want to acknowledge the incredible amount of work that our staff and our members of council put into approving our 2022 Mississauga budget last week. This budget is balanced and lean and focuses on delivering and keeping the more than 200 programs and services that you rely on, like libraries, parks, winter maintenance, and fire and emergency services affordable. It puts us on the right path for recovery while making targeted investments in our public infrastructure like transit and road improvements while enhancing public safety. The Region of Peel also passed their 2022 budget, which means residents can expect a total tax increase of 3.1%, 1.5% from the City of Mississauga, and 1.6% from the Region of Peel. While I know tax increases of any sort are not popular, prudent increases are needed to help us recover and keep our city in working order and build for the future. Now for my COVID-19 update. As many of you know, the province is closely monitoring the Omicron variant, and there are concerns about how quickly it's spreading in other areas of the province. And while Delta remains the dominant strain here in Peel, we need to be extra cautious, especially over the holidays, as many more people travel to Mississauga to visit family and friends from areas where Omicron is more problematic. It is already proving to be more transmissible than the Delta variant, accounting for nearly 30% of cases in the province yesterday alone, which is why it is so important to get vaccinated as soon as possible. Whether you need to get your first, second, or third dose, please don't delay. Book your appointment today. And on that note, I want to thank the province for the enhanced measures that were announced last week, particularly around expanding eligibility for booster doses, so we can maintain the progress that we've made so far. If you are over the age of 50 and received your second dose at least 6 months ago, you are now eligible to get your booster shot. And starting January 4th, anyone over the age of 18 will be able to book their booster shot. I, for one, look forward to receiving my booster and have booked my mother and I for our shots and encourage those eligible to do the same. And to all our hardworking parents out there, I know many of you are busy at work and juggling a lot for the holidays around the corner. If you have a child that is over the age of 5, please make it a priority to get their first dose as soon as possible. Many of our clinics are child-friendly and are doing their best to make the experience as positive as possible. Some, I hear, are even making balloon animals out of rubber gloves for the kids to take home. In addition to getting vaccinated, rapid testing, especially before gathering with large groups of people, can help stop the spread. Throughout the holidays, the province has announced testing blitzes that you might see in malls, high-risk settings like long-term care homes, and holiday markets. I know many children are also being sent home from school with test kits to ensure a safe return in the new year. I encourage you to use these test kits before you visit family or friends to give you peace of mind for a safe holiday season. I can't stress enough, these kits are not for people experiencing symptoms. If you have symptoms, please get tested at a testing facility. A list of testing centers is posted on Peel Public Health's website. I know everyone is feeling fatigued, and this is not what you want to hear right now, but trust me, the last gift you want to give this holiday season is COVID-19. I also want to thank the Premier and Minister Elliott for maintaining the proof of vaccination program, for expanding proof of vaccination for youth sports aged 12 plus, and strengthening verification by requiring QR codes on all vaccine certificates. This was the right move. I'd also like to thank the many businesses and organizations across Mississauga who are doing their part to check proof of vaccination to keep our residents safe. And now I want to provide you a brief update on the overall situation here in Mississauga. Although we are seeing case counts rise across Ontario, the situation in Peel remains stable at this time. Almost 87% of Peel residents 12 plus are fully vaccinated, and more than 20,000 children aged 5 to 11 have received their first dose. Public Health has lots of appointments available after school, on weekends, and are working to offer more pop-up clinics. For parents that are waiting or a bit unsure, there are many resources to help guide your decision. Sick Kids Hospital has a great one-on-one consultation that you can book with a pediatrician to answer your questions. As always, you can also speak to your primary care provider who knows your family best. As we enter the holidays, I know there will be more gatherings with friends and family. We must remain nimble and cautious. We know how quickly things can change, and I encourage you to gather safely this year. Make sure everyone is vaccinated, wear a mask, and if you are sick, please stay home. If you are hosting a gathering, make it safe by keeping it small. Sit people a little further apart, offer hand sanitizer, and if the weather cooperates, keep a few windows open too. If you are spending time with grandparents, seniors, or those who are immunocompromised, masking and being vaccinated are two easy things you can do to protect the most vulnerable in our community. Before I turn it over to Dr. Lowe, I want to say that I'm very much looking forward to attending the Premier's Affordable Housing Summit this Thursday, along with my colleagues from all levels of government. Tackling the housing affordability crisis sweeping our province will take all levels of government working together to solve. We need short-term solutions that will provide relief and quickly. I truly hope we leave the summit with a strong path forward that delivers real results for our residents. And with that, I'd now like to invite Dr. Lowe up to give his update. Dr. Lowe?
Thank you, Madam Mayor, and good morning. In Mississauga, current case rates for COVID-19 are at 30 per 100,000 with a test positivity of 2.4%. Firstly, I want to start by thanking our parents with children 5 to 11 who have come forward and gotten your doses. Thanks to your efforts, we are now at 84% of our 5+ population protected with 1 dose, and at 79.5% of our 5+ population with 2 doses, and that number continues to increase. I'm particularly glad that so many of our children aged 5 to 11 are accessing this crucial protection. Our situation in Peel is fluid with slight increases noted over the past weeks. I note with particular concern, however, the urgent and evolving situation elsewhere in Ontario. Many communities outside of Peel across the province are seeing surges, notably driven by the Omicron variant. Initial evidence around Omicron suggests that it moves further and faster than any other variant to date, particularly among unvaccinated populations. Some of these other communities in Ontario have been forced to implement increased public health measures in order to protect their residents. Omicron has also been detected in outbreaks here in Peel, and forecasts have Omicron quickly replacing Delta as the dominant strain in Ontario in the coming days to weeks. I know that Peel is not an island, and in absolute numbers, we still have 390,000 residents that have not yet been vaccinated with 2 doses, including those that are not currently eligible for vaccination. Our unvaccinated adults are at greatest risk with the potential for any growth in Omicron spread, which is why getting vaccinated at this juncture is so crucial. In the face of Omicron, evidence is increasingly clear that 2 doses of vaccine will continue to retain some protection against severity, but may be less effective at preventing infection and spread. Therefore, if you are unvaccinated at this time, you remain at increased risk for severe outcomes and of potentially becoming a wave of hospitalizations and intensive care demand. The question is not if, but when Omicron will take off here in Peel, and so my message today is clear. If you are eligible, and that means any resident over the age of 5, and you have not accessed your first 2 doses of vaccine yet, I urge you not to delay. You are at risk if you remain unvaccinated, particularly if you are older, and Omicron is forecast to move fast and far. Parents, I know that this is a busy time of year, but with the growing need for boosters, we need to make the most of our capacity to vaccinate our pediatric population now, starting them on their journey to protection against rare and severe outcomes while giving certainty back to their interactions out and about in community. School is out on Friday, and our clinics are open and ready to welcome you and your kids, before then or after. If you arrive and there is a line, please remain patient. The time we take to soothe your child the child ahead of yours is the same care that we'll give to your little one. We know that our younger ones sometimes need more reassurance, and our team will do everything they can to help them feel comfortable and stay brave as they access this protection. If you already have 2 doses on board and are eligible for a booster, please get your booster now. In the face of Omicron, we are rapidly restoring and expanding capacity to push out even more critical booster protection to our 50-plus population, and will continue to bring capacity online continuously with the anticipation for when 18-plus comes available as currently forecast for the 4th of January. I also urge our residents to remain vigilant as we move towards the holiday season, especially if you are planning to travel elsewhere in Ontario or further afield. The situation across our province, in our country, and internationally is changing rapidly. I urge you to continue remaining vigilant with masking indoors, in public places, and in crowds where possible, and remember that meeting virtually continues to be the safest way to move. Keep any gatherings within provincially set limits, but also remember that smaller gatherings in general mean lower risk. Please do not attend gatherings if you are sick, stay home, and get tested if you are unwell instead. And finally, no matter how busy the season is, please make it a priority to get protected without delay, whether it's your first, second, or booster shot. Visit peelregion.ca/COVID-19 vaccine for more information and to book today. And with that, I will thank you and pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now, along with Dr. Lowe, we are happy to take your questions.
Our first question is from Declan with Mississauga News. Go ahead, Declan.
Good morning, Declan.
Declan, are you there?
Maybe he's having trouble unmuting.
Good morning, Mayor Crombie.
Good morning, Declan. We can hear you now. Please proceed.
Thank you very much. My first question is for Dr. Lowe.
Yep, no problem. I'll bring him to the podium.
Thank you.
Morning, Declan. Go ahead with your question.
Thank you, Dr. Lowe. Good morning. I'm just wondering if, given the amount of time, it took quite a lot of time and work for public health to get to the current numbers in Peel of those with 2 shots. Looking at the boosters or third shots, do you anticipate it will be an easier sell to get people to get the booster or the 3rd shot, or do you still anticipate some reluctance there?
We've had an overwhelming response to our boosters at this point in time. All of the appointments that we made available yesterday have since been fully booked, and we are currently working actively to bring online an additional 40,000 appointments throughout the entire system here in Peel Public Health. That includes over 20,000 appointments scheduled for our fixed clinics, and then additional distribution to pharmacies and primary care. And then, of course, we are bringing additional capacity online. I think in the face of Omicron, where there is some clarity that while 2 doses is still good protection, against severity to a large extent, but it really is important to get that booster dose. We are working to meet what has been really significant demand. So I think it's good that many people are looking to access protection, and as we continue to bring our additional appointments online, 40,000, which will be made available starting from today and throughout the rest of the week, we continue to urge people to book those appointments and get their booster when possible. Thanks so much for the question.
Thank you.
Follow-up, Declan?
Yes, for Mayor Crombie,
Yep,
please.
I'm here, Declan.
What's the feeling in the Mississauga business community with respect to Omicron and the potential for more shutdowns, restrictions, et cetera? Can some businesses out there weather another round of that?
Oh, goodness. So certainly everyone is very concerned, and we're being very, very cautious. To my best experience, everyone is following the rules to the letter. And, no one wants another lockdown. No one wants any more restrictive measures. So that's why we're on a campaign to encourage people to go out and get their booster shot so that they have full protection. We know that the protection from the double dose does wane over time. And so we want people to be fully vaccinated for the utmost protection from this new variant.
Our next question comes from Steve from Mississauga News. Go ahead, Steve.
Mayor Crombie, how are you?
I'm very well, Steve. How are you?
Not too bad.
Good.
I have a question, I suppose, for you and Dr. Lowe.
We both be pleased.
Just wondering, obviously, you've both outlined that the situation in Peel and Mississauga is evolving and fluid, but not quite as severe as other jurisdictions. So I'm just wondering, because it does seem like Omicron does spread far and fast, should people be ready for stronger restrictions coming? Is there going to be more heading into the holidays, more specific advice, like don't travel to other jurisdictions if you can avoid it? Are things like that kind of coming in the next few days?
Well, we're watching the situation evolve very, very closely. We're very hopeful that that won't be the case because our vaccination rates here are higher than the provincial average. As you know, we're at 87% fully vaccinated, and now you see that many people have already registered for their booster. So while we were hardest hit during the first 3 waves, I'm very hopeful if we continue to be cautious and continue to get vaccinated and register for our booster shots, we could avoid any more restrictions. But of course, I'd like Dr. Lowe to respond to that too. It seems those regions that weren't as hard hit as we were during the first 3 waves are now facing some of the challenges in which we did. Dr. Lowe, over to you.
Thank you, Madam Mayor. Thanks, Steve. I think we obviously are continuing to monitor the situation with great concern. While things are different, as you've alluded to in Peel, Ontario, we recognize that we are, very tightly connected to many other parts of Ontario where we're seeing Omicron spread quickly and fast. So, I would look to the provincial government on this one, just recognizing that, we are highly interconnected as a province. I think I've made very clear, keeping within gathering limits, but remembering that smaller is better, virtual is safest. Really trying to ensure that you're getting protected with many doses. The goal is, because we do know as well that Omicron may actually spread because of just but decreased effectiveness in preventing infections, which is really what has held us till now. It is important for people to get their boosters, and also for people who are unvaccinated to get their first 2 doses to protect against severity. The concern being that if we do see more and more introductions of Omicron, particularly if the population does start to move around the holidays into Peel, my specific concern would be seeing spread into pockets of unvaccinated populations, particularly the areas of our community that continue to have lower coverage, such as in South Central and East Mississauga, where we continue to work very closely with community groups to get people their first 2 doses. So I think the important message right now is, if you're out there, if you haven't been vaccinated yet, if you're older than 5, get your vaccines, get ready, because Omicron, it's not a question of if, it's when. And then I think more broadly, I will look to our Ministry of Health and provincial partners as to how they will be addressing, or if they will be addressing, the more concerning situations that do appear to be emerging outside of Peel. Thanks for the question.
Hi, Mayor Crombie, and just to follow up on the housing summit with Premier Ford and the provincial government this week. He mentioned you had your eyes at least on some short-term relief coming from the province. Can you kind of outline some of the specifics that you'll be bringing to that conference with what may help the situation and affordability and housing in Mississauga?
Well, absolutely, Steve. And you, of course, are aware that Mississauga has conducted a report with 40 recommendations called Making Room for the Middle on how we can bring more affordability to Mississauga with respect to home ownership and the rental situation, including building more for-purpose rental and building product that middle class can't afford. So there are a lot of recommendations that will come forward from the Ontario big city mayors, and you know I'm the vice chair. Mayor Jeff Lehman from Barrie is our chair, and so we have a number of our key messages and advice on how we proceed, including gathering data on what specifically that we need to measure, looking at the land supply, the housing supply, and how we measure that as well, and what can be done with things like surplus land and also supply chain issues. So there are a number of factors that we'll be considering, but we'll be looking for assistance from all levels of government to build affordable product. And it's very important that all three levels work together to deliver that for Canadians.
Thank you. Our next question is from Khaled with My Second Home TV. Go ahead, Khaled.
Thank you, Mallory. Good morning.
Good morning.
Mayor Crombie, today it was announced in the morning, last night, the Ontario top doctor is asking people to work from home. So how do you see his call and how this will be reflected on the city of Mississauga employees?
So this is a very good question, and of course we're always closely monitoring the situation. We had been planning for a return to work in January, but now that things are evolving, that will likely be paused. I know that our senior leadership team are meeting on Thursday to discuss a path forward. We had been asking people to come in 1 day a week starting in January, and many of us do that in any case. I know many of the staff do come in and work from the office and from home. We have sort of a hybrid method here. And you must also realize that many of our employees are of course, frontline essential workers, whether they're in transit or they're fire and emergency services or PSWs at the region of Peel. So even Parks and Works, many of them are essential workers and have been required to come to work each and every day.
Thank you. And may I ask Dr. Lou as well?
Absolutely.
Thank you. Dr. Lou, you just talked about 70-30 and the third dose, but Pfizer already is looking for a fourth dose, and maybe this has to be like a routine. How do you see this, Dr. Lou?
Khaled, I think there's two things here. You're speculating far into the future, where it's very likely that COVID-19 will become part of the regular respiratory panel of diseases. It's clear now in our second winter, though, that that's not the case just yet, given that we still have large pockets of individuals who are unvaccinated, uninfected, and therefore are still novelly susceptible to this virus in the way that they were in January 2020. Ultimately, we will reach a phase where most people have either been infected or immunized or had some other more severe outcomes, such as mortality. And at that point, the virus ceases to be novel in our population. So I think in the immediate term, in the face of Omicron, the best thing we can do is make sure that we are getting our 5 to 11s vaccinated with their 2 doses, that we are getting our 50-pluses vaxxed with boosters, which is why we're bringing on all this additional capacity online, moving up our booster phase and strategy. And then in the future, it's likely that you'll start seeing combination shots for the cold and flu season. You'll see COVID and flu shots. You'll see those sort of combined together, likely in the future to deal with what will likely become eventually a seasonal endemic virus. But it's important for me to make very clear that that is not the situation that we are seeing right now. We're seeing Omicron really take off in many other parts of the province, and we know it's only a matter of time, particularly with how open and how many contacts, interactions, and travel we're seeing right now. now before it comes to be detected in Peel in greater numbers. So my message is clear. If you are unvaccinated at this point in time in the region of Peel, you need to get your first 2 doses of vaccine to prevent and forestall any severe outcomes. And if you're eligible for a 3rd dose of vaccine, please get your booster as soon as it's available. We are working day and night to bring additional capacity online in addition to continuing our 5 to 11 campaign. Thanks so much for the question.
Next question, please.
Our next question is from Pooja with Y Media. Go ahead, Pooja.
Welcome, Pooja.
Good morning, Mayor.
Good morning,
Mayor. My first question is for Dr. Lowe.
Certainly, no problem. Dr. Lowe.
Thank you.
Go ahead, Pooja.
Yeah, good morning, Dr. Lowe. I would like to know, since, Omicron spreads rapidly, so why do you think there is a myth going out there that is mild? And how do you think we can avoid these misconceptions?
It's a great question, Pooja. So spread and severity aren't necessarily the same thing. So something can spread quite easily, but actually be not severe. And we think about things like the common cold, for example. But I think in the case of Omicron, while it is very clear that it spreads rapidly, the jury is still out as to exactly how severe it is. There's some initial reports from European countries that it may be just as severe as Delta in unvaccinated populations. There is some clarity that if you have 2 doses, you are protected against severity to some degree, and that's coming out of South Africa. But again, in terms of the severity data, because you're looking at how the health outcome comes, right now we're getting on the early end about how easily it spreads, but the severity, we still have to look at these international comparators and what's happening in those countries to see what is the course of disease that is happening for the people that have been infected in that population. So that takes a little bit more time. So at this point in time, it's clear that it spreads very quickly. I think the experience in Kingston, Ontario, for example, is particularly instructive, just around the university community that occurred out there, and certainly our thoughts with many people who are impacted and infected. But I think the question around how severe it is still something that is being worked out as we start to see Omicron take off, not just here in Canada, but across many different countries. Thanks for the question.
Thank you so much. Mayor, I would like to know what are the 2 main things that you would highlight from the budget?
I think the 2 main things I'd like to highlight from the budget are the fact that it's very reasonable, very prudent. We continue to put 2% aside each year for our infrastructure and debt repayment, and that is very, very important. We run a lean city. We manage very wisely and prudently, and we look to keep costs as low as possible. And I think the area that's always of interest to our residents is snow removal, whether it's along our roads or our sidewalks, our priority roads, and we did put a little extra money in as well for winter maintenance and snow removal. So that's always important for our residents. But the key thing is the increase on the budget at the city level is 1.5%, and when you add in the increase at the region, it's 1.6% at the region for the city of Mississauga, and so combined, it's combined it's 3.1%, and I think that's very reasonable. It's around the rate of inflation. It keeps things manageable and allows us to honor all of our union contracts and continue to invest in our priorities, which is building infrastructure, repairing our infrastructure, and building public transit as well. So those are always our priorities, building transit and infrastructure, but keeping our rate increases as low and manageable as possible for our residents.
Thank you. That was your final question for the day.
Thank you. Thank you for joining us, and happy holidays. Merry Christmas.